Hi, everyone. Thank you so much for joining us today for this EWA National Seminar panel, Childcare and Early Education, Crawling to Recovery. I'm Jackie Mader, and I'm the Early Childhood Education Reporter and Multimedia Editor for the Hechinger Report. I will be the moderator for today's conversation. Before we begin, a few housekeeping notes. First, a reminder, this is being recorded. Everything is on the record, chats included. If you hover over the speaker screen, you should see a button for closed captioning and live transcript. And to start viewing closed captioning, click closed caption. To view the live transcript, click live transcript and then select show subtitle. To submit a question for our speakers, please use the chat box located in the Pathable platform. You can submit questions at any point during the session. An EWA staffer will be monitoring these questions and will facilitate the Q&A portion at the end of the session. And finally, if you're going to tweet about this, please use the hashtag EWA21. All right, so now let me introduce today's speakers. We have Katie Hamm, Acting Deputy Assistant Secretary for Early Childhood Development at the Administration for Children and Families at the U.S. Department of Health and Human Services. Hi, Katie.
Hi.
We also have McLain, Senior Research Specialist at the Center for the Study of Child Care Employment at UC Berkeley. Hi, Caitlin. And we have Rochelle Wilcox, Chief Executive Director of the Wilcox Academy of Early Learning. Hi, Rochelle. So with that, let's begin. As many of you know, the pandemic has decimated an already struggling childcare industry. Many centers have closed and many others are trying to survive but desperately need help. The federal government has allotted $39 billion in child care relief, and states recently received these funds. So today we're going to dig into the funding and potential policies that may be coming for the child care industry, as well as how reporters can report on these funds and the industry's attempt to recover. So we're going to start with Katie. Katie, first of all, I'd love to hear just a brief intro about your work in early ed. And then the question I have for you is, so states have received their portion of this $39 billion for childcare recovery. The president has also proposed the American Families Plan, which of course is meant to be kind of a longer term solution to issues facing families around childcare and pre-K, among other things. Can you talk about the opportunity here to change longstanding systems and what that change might look like?
Sure. Thanks so much for having me today. I'm really excited to be here. Want to just, thank all the reporters who joined us. I know you all have tirelessly covered childcare since the beginning of the pandemic. It has brought just new visibility to this issue. And it's just so important that Americans hear the stories of childcare providers and understand how the pandemic is impacting them, as well as their importance to American families. So just want to, I know it's a lot of work to do that and do it well, especially through a pandemic. So just want to thank everyone who's been covering this issue. I joined HHS in February as part of the Biden and Harris administration. Prior to that, I spent 7 years as the Vice President for Early Childhood Policy at the Center for American Progress. And I previously was at the U.S. Office of Management and Budget as a career civil servant. So I have been interested in early childhood programs, childcare, Head Start, preschool for as long as I can remember. It's just always been my passion to make sure that at the federal level we were paying more attention and, importantly, spending more resources on children birth to 5 and their families. So we are really at an opportune time right now when it comes to childcare. Unfortunately, it is the crisis that got us here. And I wish it didn't come to that, but I do think it has finally pushed us to a place where there is just so much more awareness about what the childcare sector needs to recover from the pandemic and what those structural issues were that made childcare so precarious at the beginning of the pandemic. So the president proposed and Congress passed the American Rescue Plan. That was signed into law in March. And as you said, it includes $39 billion for childcare and $1 billion for Head Start. Those $39 billion for childcare, which by the way is the largest ever investment that our country has ever made in childcare. 15 billion of that is basically flexible funds that states have that they can use for helping families afford childcare. They can use it for making quality improvements, improving wages, improving professional development. Very, very flexible childcare funding there. There's a second pot of funding that's $24 billion, and those resources are specifically for grants to childcare providers, both family childcare as well as center-based providers, to help them with their operating expenses. We know that during the pandemic, we've seen a decline in revenue in the childcare sector because fewer children are enrolled. We've also seen an increase in costs because they are having to do all the COVID mitigation pieces, maybe hire extra staff, serve families in new ways as families are looking to childcare providers as a support during a really, really difficult time. So those grants will be going out to providers in the coming months, hopefully with our state partners, to make sure that childcare providers have the financial stability, can keep their doors open, can pay their staff, can pay for PPE, can pay for mental health services, whatever it is that they need kind of before and after the pandemic to recover. And then the second piece, very exciting, last week, President Biden announced the American Families Plan. And so while the American Rescue Act is designed to make sure that childcare can recover from the pandemic, this is the long-term solution that we feel like we need for childcare. So there's $225 billion. I think it's helpful to compare that in a typical year, we only have about $8 billion in federal funds for childcare. So this is a massive increase. It would guarantee childcare assistance for children birth to 5 whose families earn less than 1.5 times their state's median income. That varies across states depending on average incomes in the state, but it's roughly about $100,000 for a family of 4 if you think across the US. Importantly, there would be a $15 minimum wage for all childcare providers. If you have the same credentials and experience as a kindergarten teacher, you would get paid the same way too. So it's really designed to invest a lot in quality through wages, limit what parents pay to 7% of their income, make sure that childcare assistance is really widely available. There's also a preschool proposal that invests $200 billion in universal preschool for 3 and 4-year-olds. That is through a mixed delivery system. So what that means is that it's not just in public schools, it's in the community as well, where families are already receiving services where they have those relationships. So childcare programs could be part of the preschool program. So could Head Start programs, so could private preschools. It's really designed for everyone to come together and help us get to universal preschool for 3 and 4-year-olds. So I will stop there because I know we have other panelists who likely want to weigh in, but I look forward to talking more.
Thank you so much, Katie. That was such a helpful, kind of quick deep dive into the funding. Caitlin, I wanted to turn to you now, and Katie touched on this a bit as she talked about the childcare workforce. But I'd love to hear, first of all, a little bit about your work in early ed, and then also specifically, what are the issues facing the early childhood workforce, and how could this funding help them?
Thank you. Hello, everyone. So happy to be here today. So my work at the Center for the Study of Child Care Employment at the University of California-Berkeley really focuses on the status of early childhood educators and policies to support them. I'm lead author of the 2020 Early Childhood Workforce Index, which is a biennial report that tracks early educator wages and state policies that affect educator preparation, support, and compensation across all of the 50 states and DC. And it's really important to understand that working in childcare isn't just a low-wage job. It's actually one of the worst paid jobs in America. Only 2% of all the occupations in the United States earn less than childcare workers, who earned $11.65 an hour on average in 2019. As a society, we have been asking early childhood educators to put so much of themselves into this work for wages that are not even livable in most states. And it's been even worse during this pandemic, when educators have also been putting themselves and their families at risk often without access to paid sick leave or health insurance. So I'm really heartened by the recent federal attention to early care and education and the new investments that have been coming down the pipeline. But we do have to understand that meaningful relief is coming more than a year into a pandemic that has financially and emotionally devastated childcare providers across the country. It is relief, but we also need reform and continued public investment. With the immediate funds coming through the American Rescue Plan, there are several things that states can be doing to support early educators and to shore up early care and education services. First and most important is to ensure that these funds reach individual early care and education staff in the form of direct cash payments. We have got to keep teachers in classrooms, and they need financial support to be able to do that. But in addition, we need to provide health coverage and guaranteed paid sick leave for early educators. We know that even before the pandemic, the workforce was grappling with lack of access to affordable health coverage and limited or no paid leave. And so they're really situated between a rock and a hard place, having to make impossible choices between their own health, their family's health, and their livelihood. So I really can't stress enough that we have to make educators' financial well-being and their health a priority going forward. Thank you.
Thank you so much, Caitlin. Rachelle, turning to you. First, I'd love to hear a brief intro about your work in early ed. And then also, as a provider, what are the components that need to be in a recovery or rescue plan for it to really have an impact on the day-to-day sustainability of the job and of your centers? And kind of related to that, do you have any thoughts on how your state should allocate money to be the most helpful to providers and centers and impact your sustainability?
Absolutely. Hi, again, I'm Rochelle Wilcox. I am a executive director of Wilcox Academy of Early Learning. We have 3 centers in the greater New Orleans area. I have been in early care and education for 19 years and an executive director of and founder of my center for 15 years. So a lot of what the other 2 ladies said is exactly what we need. The biggest issue for me is the workforce. Our teachers, what we need to make sure we see in the rescue plan is higher wages for our teachers. I have several programs for at my centers, and my teachers, even though I pay a higher wage than the average in our state, they still qualify for the programs that we have, like Early Head Start, or our city has a specific subsidy. They qualify for that. That's not fair. That's something that we need to make sure that we increased the teacher wage and be able to support the centers, because what happens is the higher your quality is, the higher credentials your teacher staff has, means that you often have to marginalize the actual children that deserve the care that we offer. So we don't want to continue to do that. We want to make sure that we are supporting our youngest and most vulnerable learners. So with that being said, our teachers need a professional wage. They are professionals. They need to be paid as such. Not only a professional wage, but as others said, we need health benefits. Teachers should not have to make a choice. Do I take my whole salary, or do I have to pay for health care? We need to raise the child care assistance rates. We need to make sure that all families like we just talked about, have access to child care assistance. It should not be just where not only the youngest, most vulnerable learners, but there are parents that are working poor. We have a working poor workforce that need high quality care. We also want to make sure that there are in our, especially in Louisiana specifically, we now have a wait list. Initially, we did not. Parents were afraid to bring their little people to school, as well as teachers were afraid. We didn't know what's going on, but now parents are getting back to work slowly but surely, but now we just don't have the capacity. So a good use of one-time funding is to be able to help high quality centers with facilities that we can work with and have create more access for our young learners.
Great. Thank you so much, Rochelle. And we'll dig into some more details. I would love to hear more from you as we give advice to reporters. So now we're going to move to this next section, which is specifically looking at how reporters can cover this. And as Katie, you mentioned, a lot of reporters have been covering this over the past year extensively. So I'd love to hear from each of you, maybe if each of you have one or two stories that you'd like to see done or done more by reporters, or are there any stories that aren't being covered or you haven't seen much coverage on, even with the increase in childcare coverage? So I don't know who wants to start, but yeah, 1 to 2 ideas. I know the reporters would love to hear those.
So I'll go ahead and start. One thing that I want to make sure that people understand and that it is covered is that children are not born at 4, right? They don't come out and it's just not preschool. I hear a lot about preschool, but we want to make sure that we are covering our infants and toddlers, though there is always a gap in that. I think 3 and 4-year-olds, people understand, but the fact is that our youngest, most vulnerable learners are often left behind and not talked about. So I want to make sure that we are understanding, and the fact that children learn 90% of what they're going to learn, 80% what they're going to learn by the time that they're 3. So that happens before they go to preschool. So we really need to make sure that we are focusing on or making sure that there's information or writing on infants and toddlers. With that being said, we need to talk about the true cost of early care and education, right? So in the state of Louisiana, I'm going to give you some information. So the state of Louisiana, the market rate the average is $9,100 for infant, but the true cost is $20,000. And even which I am a high quality center, I'm a 4-star center in the state of Louisiana, my highest rate is $8,100, right? So that's $1,000 under. I'm paying my teachers more. And so we're still not meeting the need. So we need to talk about what the true cost of what the true cost of early learning is. On top of that, even if we were getting $20,000 per child, the average cost of the median rate for parents in Louisiana is $41,000. That means that they would be paying half of what they're making annually in early care and education. No one can survive off of that. So we need to make sure that there is information writing on what the true cost of early care and education is, what parents are making, and how we can bridge that gap, because that is the gap that we need to see the federal government bridge.
Thank you so much, Rochelle. Katie or Caitlin, any thoughts on story ideas?
I have thoughts, but there are leaf blowers showing up right now. So let me know if you can't hear me and I will just put my thoughts in the chat. So what I wanted to mention is that this past year, we've seen an incredible awakening in consciousness around racial equity. And if we want to really address racial equity in our nation, we can't continue to ignore the women providing childcare in this country, around 40% of whom are women of color. And we know that working in early care and education overall is a route to poverty for many. But as difficult as it is for anyone to be an early educator, it's even worse for Black and Latina educators who face persistent wage gaps with their peers and have been among the communities hardest hit by the pandemic. I have more to say, but I can address that later. It's getting a bit loud.
Thanks, Caitlin. Katie, off to you.
Yeah, it's been, there's been a lot of good news on the COVID front in that more people are getting vaccinated. So we've seen rates go down in some parts of the country. And I think people are very mentally ready to move on. But as Caitlin alluded to earlier, this has been a year of financial disruption, of trauma, as people were kind of put on the front lines of a pandemic, of risking their own health. There are childcare providers who saw some of their peers contract COVID, even pass away from COVID. So the crisis in childcare is not going away. So I would just, my plea is that it continues to get coverage, that just because some states want to reopen, or we're feeling like, we're moving on from the pandemic, that we don't forget to continue to follow and see what happens to the sector. And I would just, echo what's been said about focusing on Black and Latina providers who are both just very critical to this industry, critical in their communities, and also are part of communities that have been especially hard hit by the dual health and economic crises that the pandemic created. So I would just focus on that. The other thing that I guess on a more positive note, this really is a kind of once in a lifetime moment on childcare. We have seen, people have been organizing in their states and their communities around this for a long time, and trying year after year to pass things and get people to pay attention and hear them. And that seems to be happening. There seems to be this kind of groundswell of support that kind of coincides with the pandemic, but is not only because of the pandemic. And I think that there is just finally this realization that early childhood programs matter, childcare matters. School, which we always talk about, is just school, was actually childcare all along. We just didn't call it that. And so I hope that there's some narrative around what happened, why did this happen, who led it. I think just last week we saw 2 or 3 bills in Congress. Everybody wants to have their own childcare bills. So we saw multiple committees, multiple leaders. We saw Patty Murray introduce a piece of legislation. She ran for the Senate because a legislator in her home state of Washington told her, "You're just a mom in tennis shoes," when her children's childcare was closing. She's a former preschool teacher. I just think we're seeing this kind of finally things are coalescing. We have a president saying to Congress, spend $450 billion on childcare and early education. That has never happened before. When Obama announced this in 2013, it was the first time I think that someone had mentioned early childhood in the State of the Union. So now in 7 years, we went from this is kind of on the national agenda, just kind of creeping up there, to a major policy agenda at the White House, agenda item in the White House, in Congress, in the media. And I think we need to tell that story of why now and why things are coming together, and really hone in on those parent leaders, those childcare providers, most of whom are women of color, who've led the movement over the decades.
Thank you so much. Caitlin, was there anything you wanted to add if the leaf blowing stopped?
They have gone. So yes, thank you. I think we need to understand that there is racial stratification that exists within early care and education. Our research shows that Black early educators are paid on average 78 cents less per hour than their white peers. And that's an already severely underpaid occupation. But we also have to recognize and really address the racist as well as sexist underpinnings of our entire childcare system. I mean, we see this in the longstanding disregard for the women doing this work, but we also see it in the many punitive measures that are directed at low-income families and providers who are eligible for subsidies, who, at least in the past, have had to continuously prove adherence to a really dizzying array of restrictive rules and requirements in exchange for often tiny amounts of public funding. So, if we think about that, and then we compare that to how we subsidize big businesses in this country, I think there's something there for us to be thinking about and reporting on.
Thank you so much. Well, so you've given so many great ideas, and now I wanted to hone in a little bit on the funding specifically. I'm wondering what kinds of questions should reporters be asking about the money? So either from states or from childcare centers specifically, and also how can reporters track the funding in their state and what's happening with that?
Yeah, I can start. So, the way that the federal funding works is that it goes to states, and states make states, tribes, and territories can make a series of choices about how they want to use those resources. It is important for people, whether they're reporters or other stakeholders, to engage their state leadership in that process and be clear about what is needed and understand how the state is making decisions and plans to use those resources. And different states kind of have different modalities for sharing what's in their plan, and how the decision making works, and how to get information about money that's gone out the door. For the stabilization grants, the law does require that there is an application that's posted on the website. So that is something that providers will be able to access online. And then there's also a requirement around marketing. So there should be information available in a state about how to access those resources. But I think, for reporters, I would try to understand, especially for those who are in states or communities, what's the plan? Ask those questions about how the state is going to use the money. That's kind of the best way to get answers, is to ask them directly of the leadership and find out how the resources are going to be allocated. But they are very widely available to the childcare community. And I think reporters are vectors of public information to a lot of people in a community. So, sharing that information with the public broadly can be really helpful in making sure childcare providers are aware of what is available and where to go to get more information. But in terms of kind of tracking it, I think it's probably going to be more of a case-by-case basis at the state level.
Thank you. Rachelle or Caitlin, do you have any thoughts on that, on what reporters should be asking as they're following this money?
So I also would ask who's sitting at the table when the decisions are being made. Are there any providers that are actually sitting at the table to say, because there are a lot of great ideas, right? But once it gets down to the providers, is it something that will actually work? How is it going to be implemented? How does it impact or affect the actual people that are doing the work? So I am always saying that we need to make sure that the providers, the families, the teachers have a seat at the table. So, because those are the people that it's going to directly impact. So ask those questions. Has there been a focus group? Who are you talking to? How do you know that this is going to work? When is the money getting to them? Because as one of the ladies said earlier, early care and education has always been, I'm in my office, y'all, so I'm sorry about the phone, but early care and education has always been done on a shoestring budget. The fact that there's many times for months on end that I was not able to pay myself, that I had to make sure that I paid my staff, right? And so we want to make sure, so now that there's this influx of money, how are they going to get it directly to the people that need it the most? What's the time frame? Because just holding on to it and not dispersing it is not helpful. There are centers that are closing every day. There are teachers that are leaving their heart's work to go and work for instance, there's an Amazon station that is coming here into Southeast Louisiana. They're paying more money. These people are leaving. We need to get the money on the ground, make sure that there is a provider, a teacher, and a parent at the table, and then let's see what the time frame is.
I just wanted to highlight something that Rochelle said, because it's not the first time I've heard a childcare provider say that she forwent her own salary in order to pay staff. And when we think about all the different heroes we've celebrated during the pandemic, I don't think we asked anyone else to go without pay. We celebrate doctors and nurses and mail carriers, and we should. But childcare providers have been able to ask to work without pay. And that is just, we have to stop for a moment and acknowledge that, because it's just really beyond to the pale.
Thank you so much. Caitlin, anything to add before our next question?
Reiterating exactly what Rochelle and Katie said, we did a study in California that showed exactly that, that this is not unique. Absolutely, providers have been going without pay for themselves to try to keep their businesses afloat. And I also just wanted to reiterate again how important it is for you as reporters to talk to educators themselves. So talk to directors and owners of small businesses, but also talk to the teachers, talk to teacher assistants, really understand the perspective of the people who are doing this work.
Thank you so much. Sorry, my 5-year-old just walked in. Hold on, sweetie. Okay, the next question. And then we'll go to our Q&A. So just a reminder that if you have a question, feel free to submit that on the Pathable platform. How should states or localities be measuring progress or changes in growth in the childcare recovery? Like what would reporters look for? What would they see to see, we are rebuilding?
I can jump in. I think we need to be talking about progress in terms of well-being. So educator well-being as well as child and parent well-being. And, as everyone has said today, for too long, educators' needs have gone unaddressed. And we can't have a system that works as long as educators continue to need food stamps to support themselves and their families. And so to really measure progress, we need to invest in data systems that show us how educators and children are faring. How much do educators in different roles and settings actually earn? What inequities do we see by race, for example? What kinds of on-the-job supports do the educators have or lack? And the federal government has made it a priority to collect this type of data for K through 12 teachers. But what about teachers of early care and education? As researchers, we have long struggled with the lack of regularly updated, good quality data on the early childhood workforce. And we have seen some improvements there, but we still have a long way to go.
Thank you so much. Katie or Rochelle, any thoughts on, how reporters can be tracking progress, what they should be looking for as the childcare industry starts to rebuild?
When I think about, oh, go ahead. When I think about this question, I feel like we shouldn't be looking at what existed before the pandemic as the baseline because it was not good then. So when I think about kind of from a policy perspective, what are the levers that we have to try to make sure we're supporting a healthy childcare system? I think about what I would look to is provider payment rates. Are they going up, as Rochelle said, to align with the cost of actually providing quality childcare? And I think that's especially important because, as Rochelle said, when she sets her rates to cover the cost of quality, there are families that can't afford that, and our subsidy system isn't covering most children. So the provider payment rates really need to be there to cover the cost of quality. We need to see wages and benefits coverage going way up to a minimum of a livable wage, but then having a wage ladder that rewards people for more experience and more credentials and qualifications. And then I also think about the supply of childcare, especially in low-income areas. So because of what Rochelle talked about, where you can't really afford to get to quality if parents in the community can't cover it, we see that too often, with some exceptions, the quality of the childcare, even the availability of licensed childcare in a community, reflects the incomes in that community. And so what we should be, I think a good measure of the health of our childcare system is, are we seeing quality childcare available in low-income communities, in communities of color that have been marginalized in the past by the childcare system?
Thank you so much. Rochelle, what are your thoughts?
So I wholeheartedly agree with the ladies that is why champion or try to give a matrix to a system that was broken, right? The system was just broken, but we made it work. Early care and education is heavily regulated and heavily underfunded. So now is the opportunity to fund the child, fund early care and education, and see where we can go. If we are already operating, again, we are operating on a shoestring budget, but we're making really, really good outcomes for our little people. Give us the money that we need. Let's make sure that the teachers are, I can't say it enough about teacher pay, right? The fact is that I'm sorry, I'm gonna start over. I can't say it enough about teacher pay, because the more we can pay them what they deserve, they come out of poverty, they no longer need assistance. And then they're, as well as their parents. Parents can go to work, they can go to school, they can do all of these things that will make what we're seeing right now outside in the world, all of these things that are happening. It's also a public safety issue. The better children are, the more investment we have in early care and education. There was research done that for every $1 that you invest in early care and education, there's a $13 return. There's no market, there's no stock that can do that like investing in early care and education. So how do we manage the outcomes or rate the outcomes? The fact is that we change the system and look at what new policies and what could be.
Thank you so much, Rochelle. I'm going to pass it over to Stacia to do the Q&A.
Yes, thank you all for that conversation. There were a lot of informative tidbits in there. So we're really excited that you all are here to share your knowledge with us. Have a couple questions that have come in through the chat, and reporters, just a reminder, send those questions on Pathable. The first one is for you, Rochelle. Going back to the statistics that you cited about the true cost of education, Sharon Lur she said that's a really striking statistic, and she's just asking you if you could explain a little bit more about how that true cost number is calculated.
So what is in the true cost is all of the wraparound services and high quality paying teachers at a rate that they deserve. I'm going to break it down. For instance, we have qualified teachers with a CDA, an associate's degree, bachelor's degree. Those teachers we can't pay $10 an hour, right? Those teachers we can't even pay $15 an hour. Those teachers require more money because they have a higher credential. On top of that, that means having all of the appropriate materials, curriculum, wraparound services like early steps and mental health services, facilities. So it's all of those things that are in low ratios. It's really about having low ratios. Our state minimum ratio for infant is 1:5. And so for us, we do 1:4. So there's 2 teachers in the classroom. So that increases your rate just right there. So for infants and toddlers, we do 1:4 as well. So we want to make sure that we have small ratios has proven to provide better outcomes. So it's about your ratios, about your staff credentials, about the facilities, it's about wraparound services, as well as making sure that there is a tier 1 research-based curriculum that is provided, assessment tools to monitor where children are. And so all of the services that go into high quality care.
Thank you for that explanation. We have another question from Chelsea Sheasley. She's a reporter for the Christian Science Monitor. She asked for all the panelists, she's wondering, how do you respond to the opposition to the American Families Plan or other efforts to expand childcare or early ed? And she has an example. This morning, the Heritage Foundation sent an email saying that the plan would leave families with fewer opportunities and less control over their circumstances while failing to address the real problems in childcare. Chelsea says there's been long-standing opposition that's halted previous efforts to expand childcare and early ed programs. So what do you think needs to happen differently this time around for legislation such as this to pass? And I'll just throw that to the panel. Oh, go ahead, Katie.
Oh, sorry. I thought that was for me, but I'll jump in first. I mean, the last time we tried to pass major childcare legislation was 1971. I think a lot has changed, and we should acknowledge that. We are seeing a response to this proposal. And I think that is because it has legs and it is something that can move forward. And so we're seeing a reaction. I strongly disagree. This proposal is rooted in family choice. So parents can choose a home-based provider, they can choose a childcare center, they can choose a Head Start program, they can choose a public preschool program. The family decides where they want to send their child. They decide what works for them. So I don't see any basis to this argument that families won't have a choice, because they will. And I think that the proposal gets at the root of the problem. It looks at affordability and addresses costs. So families don't pay on a sliding scale. The max they pay is 7% of their income. It addresses the wages problem that undermines quality at every turn when people don't make enough money. And it provides quality requirements. So we cover the cost of quality. We say that providers are going to get paid based on the cost of quality, but they'll also be expected to move towards higher levels of quality. So I don't see, I mean, the arguments that I've seen kind of dominating are more relying on culture wars, relying on, mothers in the workplace, really antiquated arguments that were successful in 1971, but I don't think, and I hope they won't be successful right now, when it's clear that most children are in families with all available parents working. This is just the reality of the modern American family. And I think the last year has taught us a sorely needed lesson about the importance of childcare. So I think we will see it play out differently this time around.
Okay, thank you. The next question is from Madeline Mitchell. She says, can we talk a little bit more about the specific tools or programs, et cetera, that reporters should be looking for as far as learning recovery in the next year or so? We discussed briefly that the first 3 years of a child's life are so critical: learning emotions, language recognition, motor skills. Madeline asks, are these learning losses from the pandemic reversible? And what tools do we have to accelerate learning for these kids who might not have grasped these fundamental building blocks in Zoom pre-K? So Rachelle, maybe you can talk a little bit about this, because you've been really on the ground.
So that is one of our concerns as well, about the learning loss, specifically because you get to see my mouth, right? And so for our youngest learners, that is part of how they learn. They learn through their senses. They have to be able to taste, touch, hear it, see it, smell it in order to get that concept, internalize it. So the thing is, which is what we see about brain development, is yes, of course, these things or children are able to learn over, to relearn, they're resilient. It's just about the fact, it's about, again, the teacher, the quality of care, what's going on with the parents. So giving parents that parent education to say, hey, these are the tools that you can use at home in order to make sure that your little person is getting what they need. And we do that. We do like little one-pagers. We send things home to talk about where your child is in that milestone, and to reinforce what we are doing at the center. So the other thing is that my teachers often feel like I'm yelling at them, because they're talking through the mask. But one of the things that we have created, or we say, is that we narrate everything that we're doing. I'm smiling at you. Do you see? These are my smiling eyes, right? We are just being more intentional about the language that we're using, what we're doing. But the fact is that 0 to 3, even though they learn the most we're going to learn at that age, this is when the brain is most malleable, where we can really reteach, teach again, and expand on what we're learning. So I hope that answered your question. And there are tons of assessment tools that preschools and parents can use to just gauge where they are. The other thing about that is, now is also the time to make sure that. So if we do see that there is a delay or something that we should be concerned about, now is the time to make sure that we are using early intervention tools or measurements to make sure that we are bringing those people in to make sure we are getting the children where they need to be.
Great. And that actually takes us to time. And so that, I feel like that went by in a flash. That was so informative. Thank you all again. Thank you to our speakers for being here, Katie, Caitlin, and Rochelle. Thank you to our moderator, Jackie, for leading that conversation. We will put a rough transcript up on this session page. So if you're writing stories, you can actually go back and the video should be up tomorrow, but the rough transcript will be up today if you're writing a quick turnaround. The rest of today, our next session, there are 2 sessions coming up at the 4 o'clock hour. One is on adolescence and the specific impact the pandemic has had on teens. And the other is a higher ed session about the changing career pathways and innovations in how higher ed is responding to those pathways. So we hope you'll join us. I know you've heard this about 1,000 times if you've been here at EWA tuning into our sessions, but we are also going to send an evaluation survey next week. We really hope you can give us some feedback. And I think those are all of the remarks on my checklist. So thank you again to our speakers and hope everyone has a great rest of their Wednesday. We'll see you next time. Bye.